Pharmacology, done by Hamida, pharmacist. We go now focus on pharmacology. Introduction of pharmacology. Basic pharmacology definition, medical pharmacology, clinical pharmacology. Pharmacology is a subject of medical science which deals with the study of a drug or medicine which interact with the living system through chemical processes. Medical pharmacology is the branch of pharmacology deals with the use of a drug in human body for diagnosis, prevention, suppression, and treatment of disease. Clinical pharmacology deals with the scientific study of a drug in the patient and also in the healthy person for the safe and effective use of drug. First, we go through pharmacokinetic. Pharmacokinetic is a Greek word. Pharmakon means drug and kinetic means to move. And actually this pharmacokinetic, it deals with the absorption, distribution, metabolize, and elimination. As we see in this picture, absorption is taken into the body, distribution move into the tissue, metabolize change, so can be excreted, elimination removed from the body. Absorption of drug is the process by which the drug enters into the systemic circulation from the site of administration. Except intravenous and intra-arterial routes, in these two cases, the administration of these two cases, the drug is not absorbed and it enters into the circulation directly. Distribution of a drug. All the consequences of delivery of a drug to the tissue called distribution of a drug. Distribution of a drug means dividing and spreading of a drug to the tissue. Selective distribution of a drug. It means special distribution of a drug in the certain tissue of the body due to a special affinity between particles of drug. For example, ephedrine, tetracycline, heavy metal, and digoxin. Ephedrine affect an iris, tetracycline calcium containing, heavy metal hair and nail, and digoxin on heart. Metabolism is by transformation of a drug. Actually, when you see the site of metabolism, it's liver. Here is the metabolism take place. Why it's necessary then? Metabolism is molecular isolation of a drug in a living body, with or without enzyme. Drugs are chemical substances and interact with the living organism. As we see here, as we need the drug to treat our disease, similarly, we also want to get rid of them from the body to overcome their persistence effect. The result of by transformation either is going to be active or non-active, active drug converted to inactive, or for example, active drug converted to inactive drug like morphine converted to morphine gluconate. Inactive drug converted to active like levodopa to dopamine. Active drug converted to active metabolite, and toxic drug converted to less toxic or non-toxic. Non-toxic drug converted to toxic drug. We have two routes of elimination of a drug. Major one is done by kidney and liver, and the minor one done by lungs or others like saliva, tears, milk of mother, hair. A factor affecting elimination are disease, age, obesity, and presence of a drug. Heart disease or kidney disease lowers perfusion to organs of elimination. Age reduce glomerular filtration and liver metabolism. Obesity slows elimination of lipid soluble. Presence of drug means other drugs, like phenobarbital induce liver oxidizing enzyme and cimetidine inhibit liver oxidizing enzyme. Now we go through pharmacodynamic. Pharmacodynamic is a branch of pharmacology which deals with the effect of a drug and mechanism of action. Pharmacokinetic versus pharmacodynamic. Pharmacodynamics deals with drug action and mechanism, as we said, and pharmacokinetic deals with the absorption, distribution, metabolism, and excretion. Drugs has two effects, therapeutic and toxicology, and I will tell you after we reach drug. Yes, drug. Drug derived from droge, French word which means dry herb. Definition of a drug. According to the WHO 1992, a drug is any substance or product that is used or intended to be used to modify or explore physiological system or pathophysiological state. Drugs has two effects. Therapeutic means beneficial effect and toxicology means adverse effect. Aim of drug is to improve quality of life. Basic use of drug. Drug used to diagnose, prevent, suppress, and treatment. For example, in case of diagnosis, we use barium sulfate to diagnose the GIT lesion, as you see here. Prevention, we use vaccine or contraceptive and toxin to prevent a disease or etc. In suppression and control, like insulin for controlling of diabetes mellitus and antihypertensive drugs to control hypertension. Treatment, we use antibiotic for treatment of infection, we use diuretic for edema and analgesic for treatment of the pain. Now we go through product. What is product? The drug which don't produce any pharmacological effect until they are chemically altered within the body. The purpose of prodrug is to modify absorption, distribution, and the duration of action, to reduce adverse effect, and to overcome difficulty in pharmacological effect. Drug nomenclature. Pharmacopoeia, it's an official publication written by legally authorized body constituted by law which describes drugs that are used. For example, BP is British Pharmacopoeia, USP, United States Pharmacopoeia, and INN, International Non-Proprietary Name. Naming of a drug, we have three names for drug actually: chemical name, generic name, and trade name. Chemical name, for example, we have acetyl salicylic acid. The generic name is aspirin, and the trade name is ERS. Now we go through receptor, the delicious part of pharmacology. Receptor are macromolecular structure with which the drug binds and forms drug receptor complex that initiate the chain of event leading pharmacological and therapeutic effect. Receptors are protein or lipoprotein in nature, situated on the cell membrane or within the cell, bound mostly reversibly. Receptors are either located on the cell membrane or within the cytoplasm or within the nucleus. As we see here in the picture also, extracellular, intracellular, and nucleus. These are the receptor sites. Common receptors: cholinergic receptor, adrenergic, histamine, dopamine, 5-hydroxytryptamine, opioid, GABA, and prostaglandin. Now we are going through receptors subtype. Cholinergic receptors has two types: nicotinic, muscarinic, and adrenergic alpha and beta, histamine H1, H2, and H3, dopamine D1 and D2, 5-hydroxytryptamine receptor,